Listen up, all you veterinary professionals. We've got some exciting news that will make your tails wag. VETgirl is now offering a free 14-day trial membership that will give you access to our full on-demand library of veterinary continuing education, webinars, and other resources. It's time to unleash your inner learning beast and sign up for your free trial today. Don't let this opportunity pass you by. Join the VETgirl pack and get your learn on today.
In this VETgirl podcast, we discuss the use of antiemetics in the vomiting dog and cat and whether there are any setbacks in patients that are ultimately found to have gastrointestinal obstructions. So today we're going to review a recent JVEC study entitled Delay of Definitive Care in Cats and Dogs with Gastrointestinal Foreign Body Obstruction Following Antiemetic Administration, 537 cases between 2012 and 2020. Now, we've all been in this situation before. An animal presents vomiting, and for various reasons, you first try managing the patient's symptoms with anti-nausea medications, some subcutaneous fluids, and maybe a recommendation for a small fast followed by a bland diet. But then the pet re-presents the next day with persistent vomiting. You perform further investigations, which reveal a GI obstruction, and now the pet needs surgery or endoscopy. And if you're anything like me, you may start to wonder, did this delay cause more problems for this pet? Academically speaking, does this count as a delay in getting the patient definitive care? Or can we consider a trial of antiemetics to actually be a useful part of the investigative process? Maybe most important to ask is if complications are more common in cases where antiemetics have delayed definitive care. Now, these are all questions that divide opinion. To shed some light on how antiemetics fit into management of such cases, these authors retrospectively reviewed 537 cases of dogs and cats with GI foreign body obstructions that were confirmed by endoscopy or surgery. Dogs and cats were divided into two groups, those that had received an antiemetic during their initial management and those that had not. The authors then explored differences in time to reaching definitive care, which was surgical or endoscopic retrieval of the foreign body, the procedures required, hospitalization lengths, and outcome between the groups. As mentioned before, this was a retrospective study and was conducted across 3 emergency and specialty veterinary hospitals in the U.S. Cases were included if they had a presenting complaint of vomiting, diarrhea, abdominal pain, or anorexia, and there was eventually a definitive identification of a GI foreign body obstruction during exploratory laparotomy or gastric endoscopy. Just a note to highlight here is that animals that had non-obstructive GI foreign bodies that passed on their own accord with or without symptomatic treatment were excluded from this study. So this study is not able, nor is it trying to document the benefits of giving an antiemetic in these cases. That would require a prospective study. And incidentally, that's a great idea for a study if anybody was so inclined. So of the 537 cases, 440 were dogs and 97 were cats. The median age of both species was very similar at 3.1 years for dogs and 3 years for cats. 216 or 49% of the dogs were neutered males. 133 or 30.2% were neutered females. 67 or 15.25% were intact males. And 24 or 5.4% were intact females. Cats were mostly represented by neutered males. There were 57 of those, or 58.7% of them. 37 or 38.1% were neutered females, and 3 or 3% were intact females. Data collected for all animals included the date and time of onset of clinical signs, description of the clinical signs, any antiemetics that were administered, what their definitive treatment was, time of collection of the deposit for surgery or endoscopy, any complications that developed, including things like GI perforation, focal necrosis, which would necessitate an enterotomy, aspiration pneumonia, and overall outcome. Antiemetic medications were given to just over a third of the cases, so 200 out of the 537 animals, so 36% of dogs and 43% of cats. The antiemetic most commonly administered was meropitant in 90% of cases, but others included a combination of meropitant with ondansetron, meropitant with metoclopramide, metoclopramide alone, dilaceron alone, And lastly, aminopentamide. 12% of the patient population received an unknown antiemetic because the drug was not recorded. The study found that the median time from clinical onset to definitive treatment was longer for the antiemetic group at 3.2 days than for the no antiemetic group at 1.6 days, which was found to be a statistically significant delay for animals given antiemetics. This means that definitive care was delivered later for dogs and cats that had received an antiemetic compared to those that had not. Animals that experienced complications, again, things like GI perforation or necrosis, were found to have waited a longer time from the onset to definitive care, a median of about 3.5 days in the group that had complications, compared to a median of 2.1 days in those that didn't have any complications. But overall, the complication rates in the antiemetic group were not statistically different from the complication rates in the no antiemetic group. In patients requiring resection and anastomosis, 5% were from the antiemetic group and 4.3% were from the no antiemetic group. Overall, survival was excellent in this study, with 99% surviving and only 0.9% of animals in both groups dying or being euthanized. So, how do we interpret these results? Based off this study, we can conclude that animals receiving an antiemetic generally received definitive care later than animals that did not receive an antiemetic. That's a neat conclusion on its own, but there were some other interesting findings to consider. In this study, the authors found that regardless of whether an antiemetic was given, those that experienced complications were more likely to have experienced longer delays to receiving definitive care. This aligns with previous studies suggesting that prolonged clinical signs correlate with an increased risk of complications. That said, we need to be aware of the limitations of retrospective studies. Remember that with retrospective data, when groups are constructed based on one variable, we can't assume that all other variables are the same across both groups. They're not controlled, so there may be other important differences influencing a study's outcome. In this study, we don't know what factors influence the veterinarian and the owner to ultimately lead to one pet receiving or not receiving an antiemetic first. Maybe costs were involved. Perhaps the animals in the no antiemetic group were sicker on presentation, making it more clear to owner and veterinarian alike that these pets needed urgent workup. We can see from this study's results that the time from onset of clinical signs to antiemetic administration in the antiemetic group and the time from onset of clinical signs to definitive care in the no antiemetic group were actually very similar. What we can say is that for animals in this study that were administered antiemetics, the relative delay was not problematic and the risk for complication was not more likely. So what do we take away from this VETgirl podcast? Ultimately, treatment with antiemetics or medical management in dogs and cats that may have GI obstructions is not contraindicated. That said, it's important that if the patient isn't showing marked improvement or is worsening, pet owners should be advised to seek veterinary attention urgently for further diagnostic investigation and treatment, which may include surgery. Lastly, we should pay close attention to the pet's history. How long have the clinical signs been going on for? We can use this information to guide our discussion and recommendations with owners. This key information may support the need for additional diagnostics, such as a referral for an ultrasound or maybe even a barium study, to rule in or out a GI foreign body obstruction and help get the pet definitive care sooner for best outcomes all around.